guys, so I'm going to talk about the difference between Orbera, which is the weight loss balloon procedure, and vertical sleeve gastrectomy. Now, this topic was inspired by a member of the community who responded to one of my questions about your goals, something you want to accomplish before the end of August. And that individual shared that they need to make a very large decision about whether or not to do vertical sleeve gastrectomy, or VSG for short, which is a bariatric surgery procedure for weight loss, or the Orbera balloon procedure. I don't think she said Orbera specifically, but that's the model that I have today. So I'm going to talk really quickly about what is the difference, and this is very, very brief. So the balloon procedure, and you can see there's a balloon here in the stomach. This is a model of the stomach. Thank you, Carolina Digestive, for providing me with this model several years ago. So for the balloon procedure, this is a type of weight loss procedure where a GI doctor or a bariatric surgeon inserts a small balloon and fills it with saline or fluid to have it expand to the size of a grapefruit in the stomach. That balloon stays there for 6 months, and people lose on average 20 pounds. How do people lose weight? Well, that balloon being there makes them feel fuller and they eat less food over time. After 6 months, once this procedure has gone its cycle, this balloon is taken out, and that individual who during that 6-month period should have been following certain eating and exercise habits is tasked with maintaining that weight loss, and 20 pounds is average. Some people may lose more, some people may lose less. So it's a procedure that's done here in Charlotte. And what are the pros and cons? Well, one of the huge pros is that it's not permanent like vertical sleeve gastrectomy, where a portion of your stomach, about 70 to 80% of your stomach, is surgically removed and thrown in the trash, and then you're left with the remainder. So one of the pros with the Orbera procedure is that it's less permanent. There are slightly less risk. It's a quicker procedure. There's not anesthesia involved. There's no large incisions. The weight loss amount is less than vertical sleeve gastrectomy, where those individuals may lose 50 or more % of their excess body fat, over 100 pounds or more compared to 20 pounds. The BMI requirement is different. So the BMI requirement is lower for the balloon. You can have a BMI as low as 30 and meet qualifications for this procedure, whereas for the VSG and the gastric bypass surgeries, you have to have a larger BMI, so over 40 or over 35 if you have a weight-related complication like diabetes or sleep apnea or osteoarthritis. Those things would qualify you for that procedure. Another large difference is that Orbera, as far as I know, is not covered by medical insurance. So it's an out-of-pocket expense, whereas VSG is covered by most insurances. So if you're paying for the balloon out of pocket, it's going to cost you about $4,000 to $9,000. The average cost in Charlotte, I believe, is actually $6,000, but that's all cash. Whereas you wouldn't be paying as much cash for the VSG. You may have to pay for your protein, your nutrition appointments, and things like that, but you wouldn't be paying for the actual procedure itself. So those are some slight differences. This is not intended to be a long drawn out conversation, but to give some little brief differences. So for that individual who is making a decision, my advice to you is think about your risk. Think about the amount of weight that you have to lose. Think about whether or not you can commit to a permanent procedure versus a non-permanent procedure. And think about where you want to see yourself a couple months from now, and a year from now, and several years from now. But either way, I trust that you'll make the best decision for you. And also lean on the guidance of your medical team, your bariatric surgeon. I'm sure you did a consultation with them, and your primary care doctor. All of those individuals are there to lead and guide you. And I do want to put a little tip in terms of medical weight loss, which is what I do. I do not do surgical procedures. We do get similar results with weight loss medications as well in terms of the balloon. We have medications that make people feel fuller, that suppress appetite, that give people more satiety. They eat less frequently, they snack less, and they can lose anywhere from 20 to 100 pounds as well. So consider that as an option. I hope that this was helpful. I'll see you guys next time. Bye.